Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today's topic is stem cell therapy for Autism Spectrum Disorder in India. So what exactly is Autism Spectrum Disorder, known for short as ASD? Well, these days it includes several conditions that used to be diagnosed separately. So you have autistic disorder, and then also underneath the ASD umbrella is pervasive developmental disorder, not otherwise specified, and Asperger's syndrome. It includes difficulty with communication and interaction with other people, restricted interest and repetitive behaviors, symptoms that hurt the person's ability to function properly in school, work, and other areas of life. How common is it? The worldwide studies show that about 1 in 54 children are diagnosed with ASD. Because the ASD criteria changed over the last decade, it's hard to compare historic numbers. It's 4 times more common in boys than it is in girls, and it's reported in all racial, ethnic, and socioeconomic groups. So how is ASD diagnosed? Well, it's not always easy. It's not like there's one lab test where you go, aha, this child has ASD, because there's a wide range of symptoms. So usually it's a 2-step process. First of all, there's a pediatrician assessment regarding milestones on behavior, voice, sleep, etc. And it often involves a team of specialists, such as a child and speech pathologist, maybe an occupational therapist, and neurologist. Usually there's problems with 2 categories to get the diagnosis. One involves communication and social interaction, and the other involves restricted and repetitive patterns of behavior. Now, traditional therapies for ASD are not great. There's no one standard treatment and there's no cure for it, but it does focus on each child's specific needs. So it could be behavioral management therapy, cognitive behavioral therapy, various education and school-based therapies. There are some medications, nutritional programs, occupational therapy, physical therapy if necessary, and speech therapy. The medication options may include several things used off-label, such as antidepressants, whether it's tricyclic or SSRIs, antipsychotics, or stimulants. A lot of kids with ASD have hyperactivity, so that's why the Ritalin might be used, anti-anxiety medications, and there's a significant amount of children with ASD who have a seizure disorder. They often go hand in hand, so anticonvulsants. So when it comes to stem cell therapy, it's been remarkable. It's one of the first treatments that can actually get to the root cause of the problem. It's not a cure, but treatments to date have focused on the use of what's called multipotent stem cells. There are no treatments with embryonic stem cells or induced pluripotent stem cells. They just are not there yet. We use mesenchymal stem cells, known as MSCs, or HSCs, known as hematopoietic stem cells. How do they work? Well, there's a lot of different ways that they act on the body and the central nervous system. They do reduce inflammation. They also modulate the immune system. They act to form new blood vessels, which is called angiogenesis. And one of the most important ways they act is cell-to-cell signaling for reprogramming. That's called paracrine signaling. So as I mentioned, it's not a cure, but as you'll see, it can dramatically help. Recent evidence suggests that immune dysregulation and neuroinflammation play a role in the cause of ASD. Stem cells are able to strongly inhibit CD8+, CD4+, T lymphocytes, and natural killer cell overactivation and proliferation by inhibiting pro-inflammatory tumor necrosis factor alpha and other things that modulate the immune system to help with ASD. So let's go through a few research studies looking at the role of stem cell therapy for ASD. Here's one from 2019, which discussed how MSCs can be transplanted directly without genetic modification or pre-treatment. They differentiate according to the cues from the surrounding tissues, and they don't cause uncontrollable growth or tumors. That's very different than embryonic stem cells, which immediately get rejected by the body, and they can cause tumors. Several proof of concept clinical studies and meta-analyses have shown the safety and effectiveness of MSCs for autistic patients. So I do want to mention, before we go into a couple more studies, that embryonic stem cell therapy and induced pluripotent stem cell therapy are not ready for clinical use by a long shot. So if anyone suggests that type of treatment, you should run away. The treatments that we offer with mesenchymal and hematopoietic stem cells are the way to go for safety and effectiveness. All right, so very excellent results to date. Here's a combination of the various clinical trials as of 9 years ago. Promising and impressive results have been reported from the clinical studies published to date. The exact mechanism, I discussed earlier how the stem cells work, but we don't know exactly how they work when it comes to autism. Here's a study out of Stem Cells in Translational Medicine. Autologous cord blood infusions are safe and feasible in young children with ASD. This was a study out of Duke University. This was 25 children. In this study, the phase 1, they did using children's own umbilical cord blood. They used a lot of nucleated cells per kilogram, up to 5 times 10 to the 7th, which is up to 50 million stem cells per kilogram. They used an IV infusion only, and they had very significant improvements in behavior in the first 6 months, and it was sustained at a year. All right, so here's a study, 2 studies. First one's out of the Journal of Translational Medicine, Stem Cell Therapy for Autism. They proposed the combined use of mesenchymal stem cells and cord blood, CD34 plus cells, which may be useful in the treatment of autism. And then another study out of the Journal of Biomedical Biotechnology. Due to the particular immune and neural dysregulation observed in Autism Spectrum Disorder, MSCs can offer a unique tool to provide better resolution for the disease. So for the R3 Stem Cell International Autism Treatment Program, we offer treatment in India, in New Delhi, at a gorgeous new location. Our stem cells come from FDA-regulated labs in the United States, so USA technology. We've been doing this for over 10 years and 21,000 stem cell procedures. We've had a pristine safety record. We've never had a significant adverse event. It could happen in theory, but it's been amazingly effective and safe with over 85% patient satisfaction. Our quality assurance exceeds FDA standards. We use umbilical cord tissue, predominantly umbilical cord blood, along with exosomes, stem cell exosomes, and the combination has been incredibly effective. And in India as well, we offer hyperbaric oxygen treatment to go along with those to help activate the stem cells. We do multivitamin infusions too to help prime the system. Our stem cells have a very high viability of over 90%. Our procedures are performed in New Delhi. We start the process with a free phone consultation. We don't charge for that. We have a patient concierge representative who will be assigned to you, who will assist you with all the travel logistics, including travel from the airport to the clinic, hotel, and back. All international patients receive a free trip to the Taj Mahal. I did this trip when we started the construction there, and I can tell you that the Taj Mahal, it's like a postcard. It is amazing to see. It's one of the 7 wonders of the world, so you definitely want to take advantage of that and check that off of your list. It's incredible. It's only about an hour and a half from the clinic. We take you there, bring you back. We have a private, guided tour for you. It's the best way to do it. All right, so there's a couple options that you can take advantage of. One is you can come with your child for multiple visits over a year, and that could be upwards of a couple 100 million stem cells total. This depends on the child's weight, so we'll calculate it by the weight, and then it's the physician judgment as to the multiple for that. We offer the most cost-effective stem cell therapy program in the world, by far, okay? 2 to 3 times less than what you would pay in the USA or Panama or China with other centers. The other option is you can come and with your child stay for 2 to 5 to 7 days, and you can get the 200 million or more stem cells, and we intersperse that with the hyperbaric oxygen, and it's fantastic outcomes, and once again, high safety standards that we use. All right, so start the process today. Visit us online at r3stemcell.com/India, and you can call us either at the number on that website or at our headquarter number, which is 1 prefix for the USA, 888-988-0515. Thanks. We look forward to helping you.